Kidney failure, a serious medical condition, occurs when the kidneys are no longer able to adequately filter waste products from the blood, leading to a dangerous accumulation of substances such as creatinine. Symptoms typically emerge as the condition progresses, often manifesting as swelling in the legs, ankles, or feet, fatigue, and changes in urination frequency and appearance. High levels of creatinine, a waste product normally excreted by the kidneys, can indicate deteriorating kidney function, causing patients to experience nausea, difficulty in concentrating, and muscle cramps. Treatment may range from medications to manage symptoms to more advanced interventions like dialysis or kidney transplantation, depending on the stage and severity of the kidney failure. Risk factors include diabetes, high blood pressure, recurrent kidney infections, and prolonged use of medications that can harm the kidneys. Here's a deep dive into the intricate aspects of kidney failure and creatinine levels, encompassing causes, progression, and management strategies. Primary organ involved: kidneys versus blood. Kidney failure and elevated creatinine levels are directly linked, as creatinine is a waste product filtered out by healthy kidneys. When the kidney's function is compromised, creatinine accumulates in the blood, signaling potential kidney failure. This condition becomes a critical consideration in the differential diagnosis of diseases affecting the kidneys versus those primarily involving the blood. Distinguishing the primary organ involved is crucial because it impacts the entire diagnostic and treatment strategy. Elevated creatinine levels may indicate intrinsic renal pathology, whereas blood-centric disorders could present with other abnormalities without directly causing kidney failure. Thus, a comprehensive evaluation, including renal function tests, imaging, and possibly hematologic assessment, is essential for an accurate diagnosis and determining the right course of treatment. Nature of measure: functional loss versus biochemical marker. Kidney failure signifies extensive damage to the kidneys, impairing their ability to filter blood and maintain homeostasis, leading to accumulation of wastes like urea and creatinine. As functional capabilities deteriorate, patients may experience fatigue, swelling, or dyspnea. Creatinine levels, on the other hand, are a biochemical marker, elevated when kidney function is compromised. This disparity is crucial. While creatinine levels offer a quantifiable indicator of renal impairment, they don't always correlate with symptom severity. Early kidney damage may show minimal change in creatinine, whereas advanced disease might present with disproportionate symptoms despite only moderate elevations in blood creatinine levels. Understanding both functional loss and biochemical markers is vital for accurate diagnosis and management of kidney disease. Chronology of indicators: long-term decline versus immediate indicators. In patients with kidney failure, creatinine levels serve as a crucial indicator of renal function. A gradual increase in creatinine over time typically suggests chronic kidney disease, CKD, characterized by the persistent decline in kidney function. This deterioration can be a result of conditions like hypertension or diabetes, which damage the nephrons, leading to a gradual loss of filtering capacity. On the other hand, a sudden spike in creatinine may point to acute kidney injury, AKI, which is often precipitated by a direct event such as drug toxicity, severe dehydration, or an abrupt blockage in the urinary tract. Differentiating between CKD and AKI through the chronology and magnitude of creatinine changes is vital because it influences treatment strategies and the potential for reversing kidney damage. While CKD is managed with a focus on slowing progression, AKI may be reversible with prompt treatment of the underlying cause. Primary cause: organic damage versus metabolic byproduct. Kidney failure and elevated creatinine levels often go hand in hand, providing valuable diagnostic insight. Creatinine, a metabolic byproduct of muscle metabolism, is normally excreted by the kidneys. However, when the kidneys are damaged, their filtration capacity diminishes, causing creatinine to accumulate in the blood, a clear sign of renal dysfunction. Assessing creatinine levels is pivotal in detecting kidney failure early. Contrastingly, the cause of kidney failure itself can vary. It may stem from direct organic damage due to diseases like glomerulonephritis or from systemic conditions like diabetes that gradually impair kidney function. Understanding the primary cause is essential for targeted interventions, aiming to either halt progression or manage the metabolic consequences of reduced kidney function. Treatment focus, organ support, biomarker management. In tackling kidney failure, treatment often revolves around the dichotomy of organ support versus biomarker management, such as creatinine levels. Opting for organ support may involve strategies such as dialysis or transplantation, directly targeting the failing kidneys to sustain bodily functions. On the other hand, managing biomarkers like creatinine levels, a byproduct of muscle metabolism and a key indicator of renal function, focuses on mitigating the systemic effects of the disease. Adjusting medication, diet, and fluid intake can influence creatinine levels, indirectly reflecting the kidney's filtering abilities. This nuanced approach underscores the importance of personalized treatment plans that concurrently address immediate organ support needs and the long-term management of crucial biomarkers to better assess and adapt to the progression of kidney failure.